Good day, everyone. I am teacher Sheila May Sagadal, and I will be discussing the contributions of Adlerian approach in the field of counseling. Before we start, we will be having a short recall about the concepts, major beliefs, and themes of Adlerian approach to be followed with the contributions that are divided into different parts. As we recall, Alfred Adler worked with the big guys in the psychology industry such as Sigmund Freud and Carl Jung. But what makes him stand out is that he claims that there is an overemphasis on the sexuality part. So his theory revolves around personality, social factors, and the effects of childhood in the mindset of an individual. Now let's proceed to the contributions of Adlerian approach divided within the psychodynamics, psychotherapy, psychopathology, theoretical constructs that Alfred Adler introduced and emphasized, theoretical concepts that are relevant in Adlerian approach, and of course the different modernity influences in the counseling of today's era. So now, Alfred Adler pioneered the psychotherapy, which is a general term about treating mental health conditions through a conversation or dialectic manner. Psychotherapy is conducted within a professional, which is called counselors, and these counselors have authenticity and genuineness and willingness to help their clients. Years later, Bateman 1995 stated the six goals of psychotherapy, which are crisis stabilization, symptom reaction, long-term pattern change, maintenance of change, self-exploration, and coping strategies. And these are addressed with the four stages of Adlerian approach. Field he contributed would be the psychodynamics, or the study of the different factors that affects the mentality, behavior, and attitude of an individual. Some of the theoretical constructs that applied in this theory are personality, birth order, superiority and inferiority complex, early recollections, and other factors mentioned. Adlerian approach also contributed with the field of psychopathology, which is the study about abnormal mental states, which includes anxiety, depression, mental health problems, personality disorder, schizophrenia, and eating disorders. And these are addressed to the four stages: the building of relationship, assessment, insight, and reorientation. Now let's proceed to the six main theoretical constructs that Alfred Adler introduced and emphasized. So I thematized it and divided into two. So now for the first one, we have the birth order, lifestyle, and the inferiority and superiority complex. Birth order creates a feeling of dethronement, which affects the lifestyle and mindset of a child. And these are contributed or a factor with feelings of inferiority and superiority. Now let's proceed to the next set of theoretical constructs, which are: the first is early recollection, the intended meaning to the memories that affects the personality of an individual. And over time, there are different tests that emerge to measure these aspects, such as Minnesota Multiphasic Inventory Test and the 16-factor questionnaire survey. And we also have the empathy, which is the general central theme of the Adlerian approach. We are moving forward with the theoretical concepts that are still present in the field of counseling. So we have them thematized it. So the first one will be the life goals, which are communicated through the Adlerian approach. And these life goals are achieved through a collaborative relationship with the counselor and the client. And also, they use the dreams as a rehearsal of future actions. The next would be that Adlerian approach utilizes the use of early recollections that shortens the time of counseling. And this early recollection is also the start of clinical usage in addressing mental health problems. The third will be that Adlerian approach introduced mistakes and that there is a need for having an action plans in correcting these changes, these behaviors, and that the Adlerian approach uses a trusting and encouraging environment to foster positive reaction from the client. And lastly, for the theme, we have the cognitive process, which indicates that the Adlerian approach believes that there is a learning point and unlearning point of having these early recollections to address and straighten the misconceptions and different or negative emotions that they felt during the childhood. relation to the last theoretical constructs, of course, the Adlerian approach also has different field of studies. Aside from cognitive, we also have humanistic, community health, and existential. So now we have the existential as Adlerian approach helps the client to gather self-awareness and master self-worth. Approach also caters the individuality in humanistic, embracing the humanness, the emotions, the mistakes, the human relationship of an individual, and of course the community help in dealing with the mental health problems, supports the community factors, and etc. Now we will deepen our knowledge about the use of early recollection that shortens the time span of Adlerian approach, hence making the Adlerian approach flexible and also integrative. When we say integrative, it is not just a theoretical, but it's also a technical theory. Furthermore, Bitter and Nicole of 2000 stated that there is an integrative framework that includes time, focus, counselor directive, symptom solution, and behavioral task. So inside the four stages, no, there is a focus of the time and specified goals that affects the success of the theory. Significantly, Adlerian approach is experiential, cognitive, and behavioral in application. So there are different techniques such as the first is I messages or the taking one's accountability of his or her own actions and thoughts. The second is acting as if, so acting intendedly to achieve behavioral changes and also paradoxical techniques. Moreover, as time progressed and many more counseling techniques emerged, they still anchored it with the Adlerian approach, such as eclectic technique or use of different techniques in one sessions, expressive techniques, dialectical techniques, cognitive behavioral techniques, paradoxical techniques, or the framing of indulging into one's negative behavior, and even in conflict management and coping strategies. Lastly and significantly, Adlerian approach is not just a theory but also revolutionary in nature because it affects the system of counseling, such as the use of freedom of the client variables, embracing diversity and cultural context, and also cooperative nature, and lastly, the use of narrative as facts.